Follow-up: facelift or fillers? I am thinking of getting a face and neck lift with possible lip fillers. My main reason for wanting the surgeries is to get rid of the lines when I smile. Would a facelift and neck lift achieve this?
Thank you for your question. You submitted photos and you stated in your question that you're considering a facelift and fillers to improve your lips, and that the main reason you want to have these procedures is to address the lines that occur when you smile. And so it's important that you really understand what the intended benefit of a facelift is and fillers before you decide that this is the only way to define success for your procedure. A little bit about my background: I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and fellowship-trained oculofacial plastic surgeon through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, an organization also dedicated towards cosmetic reconstructive surgery towards the eyes and face. I've been a practicing physician surgeon for over 20 years in Manhattan on Long Island. And so consultations with patients are very often about understanding problems than defining solutions. We have a lot of options and there are a lot of ways to do things. So what we have to do is always zone in on priorities. So let's start with just first defining what it is that's been overall, my first impression, I would say, by looking at your photos. And so the photos clearly show the natural signs and appearance of facial aging. Light skin, you have some hooding over your eyes, you have some jowling, some loss of definition of the jawline. So a person like you, in our practice, we would discuss options such as cosmetic upper eyelid surgery. We would discuss various types of facelifting and neck lifting. But when we talk about the intended results with upper eyelid surgery, for example, it's about addressing hooding over the eyes, so extra skin that makes the eyes look tired. With face and neck lifting, we are lifting sagging cheeks, we're improving jawline, we're improving the neck. Now, what about the lines when you smile? Well, when you look at the lines when you smile, there are two contributing factors to those lines. One is sagging or redundancy, and one is thickness or skin quality. With a lift, you can address the redundancy, but you cannot change the skin quality. The skin gets thinner. Facial aging is loss of volume as well as descent. So you lose bone, muscle, fat, soft tissue, or frequently what people remember is the loss of collagen in the skin. And then there's sagging or loosening of the soft tissue, the support structure, the SMAS, the superficial muscular aponeurotic system, the platysma, all contribute to this facial aging changes. So when we perform, let's say, a facelift, we will, in the right patient, concurrently perform fractional CO2 laser, lasering the skin to improve the skin quality. We also use something called platelet-rich plasma, which is using your own blood and taking the growth factors and using those growth factors as an injection to place under the skin to stimulate collagen. When you think about why your skin gets so crepey and thin, or when you smile, it has a lot to do with skin quality. When you look at a younger person, there's volume, there's thickness. Now, this is something that can be done ongoing, but I would say it's worthwhile for you to step away and look at the big picture. Look at your face as a whole. When we look at ourselves, we look at ourselves in detail, and we tend to magnify those details and then lose the forest for the trees. Think about what you want to do as an overall global improvement. For example, when we do platelet-rich plasma injection just for complexion improvement, patients will always come back and say, or often come back and say, You know, everyone keeps asking me why I look so good, because they get a glow to their skin. They get this nice, healthy quality to their skin, and that's without surgery. So you may want to consider just not doing surgery and addressing your skin alone. So I think you should meet with qualified, experienced cosmetic surgeons, learn about the different modalities. Not everyone does PRP or platelet-rich plasma, but I think it's worthwhile for you to explore based on our extensive experience in our practice, so that you can learn about the way to maximize your results and get the best results for the amount of effort and investment you want to make into helping you look your best. So I hope that was helpful. I wish you the best of luck. And thank you for your question.